Good morning. I'm going to do a very quick overview of Ireland's market model in the light of the analysis that Professor Penn gave us earlier. I'm going to go through fast, covering a lot of stats, facts and figures, but the full details of everything I'm going to say it's in the last chapter of the report. So if you want to check up on the figures, it's all in there. So it's like a whistle-stop tour through Ireland's market model today. And there are two types of source this draws on. Firstly, national data. As was said by Professor Penn earlier, we're very short of data on early care and education in Ireland, but we do have an annual survey that Pobl publishes based on a survey that goes to early years services. So that's a key source for facts and figures. I also use the Growing Up in Ireland study and a number of government publications. But this also, what I'm going to talk through, also draws on interviews that we carried out with a number of service providers. We had initially started, we had planned to do a survey of all services in the country, but we did a pilot last summer, but it proved very difficult when we looked at the figures coming out from the pilot to ensure that the figures were comparable. People, in a sense, were interpreting questions in different ways, and it proved a difficult exercise. So instead, what we did was we carried out a number of in-depth interviews. We interviewed 22 managers of early years services who between them managed 45 services. That's about 1% of all the services in the country. It's not a representative selection of services that we interviewed, but it was varied. We tried to ensure variation in urban, rural, private, community, large, small, a mix of different types of providers to give, I think, a bit of flavour of what the reality is like on the ground in early years services. So I'm going to start with, I suppose, the conclusions that come out from this review. The key messages. Firstly, yes, Ireland does have a market model. Those working in the sector are not seen as a profession, and there's a very low level of public investment in comparison with other countries. And the consequences of that are, in just the same way that Professor Helen Penn described, variable quality, high parental fees, and unequal access. However, what we found looking at the statistics, but also talking to the service providers we interviewed, the free preschool year has really changed the debate. It's changed the relationship of government and service providers in a number of significant ways. You know, many services are actually now, if not largely funded, maybe some of them are even fully funded by the state. Private providers fully funded by the state. We now have, minimum qualifications being brought in by the government. And through initiatives like, say, the higher capitation grant, the state is actively incentivizing professionalization. So I'm going to argue that the free preschool year has, I suppose, set in train the beginning of what could be a new model, moving away from that market model that is the legacy, if you like. So I'm going to start with the child. Clearly, we're talking here about children from birth through to 6 years old. And the settings that children are in clearly vary as they progress through that period, those 6 years. For children under 6 months, almost all children are cared for at home by a parent. And from the age of 3 or 4 onwards, nearly all children are first in the free preschool year and then go to primary school. And what happens between those ages, it changes over time. So I've got here some figures from, I don't know if maybe it's a bit low down for people at the back, but as I say, all of these are in the report. These are some figures from the Growing Up in Ireland study that show that at 9 months old, actually the majority of 9-month-olds are being cared for by a parent at home, 62%. With children who are in non-parental childcare, it's fairly evenly split between relatives, typically grandparents, childminders, and centre-based services. At 3 years old, which is the columns in blue, the picture is slightly different, though not very different. It's still half of all 3-year-olds. This is just before they enter the free preschool year. Half of 3-year-olds are at home in the care of their parents. The proportion in centre-based care has increased quite substantially from 11% at 9 months to 27% at 3 years, and little change in the proportion of children cared for by childminders or grandparents. So I'm now going to focus on those who are providing early childhood care and education. And starting with just some figures on the numbers of providers. Taking centre-based care and education services first, we have around 4,500 services. And one thing we've noticed, we don't have any figures for it unfortunately, is perhaps a growing trend of services that are located on the sites of primary schools. They may be private providers renting a room from the school, but a number of those people we interviewed talked about that as an experience, and it seems to be a growing trend. I don't have any figures on it. There are about 24,000 educators working in these centre-based early care and education services, caring for something in the region of, and these are estimates from Pobble, something in the region of 135,000 children. Childminders. Well, if you look at the TUSLA website, which lists all notified services, I checked a couple of weeks ago and there are 194 childminders. Well, that's clearly unbelievable, and I think it simply reflects the fact that childminders are mostly exempt from regulation. So Good Bodies estimated a couple of years ago there are something in the region of 19,000 childminders caring for young children. Something in the region of 50,000 young children are cared for by unregulated childminders. And just to set that in context, which I'll do a couple of times in this presentation, let's not forget that a lot of 4- and 5-year-olds are in school. Something like 100,000 4- and 5-year-olds are in primary school already. So I said earlier that the settings that children are in varies by the age of the child. So I'm going to give a little chart here that just shows actually what the current mix is of age of children in centre-based services. And actually only 3%, very few children in centre-based care and education are under a year old, which certainly reflects, I think, the cost to parents and to services of meeting the ratios that are required. It's really a story we heard from many of the people we interviewed was it's not economical anymore to deliver full day care to very young children. The proportion aged 1 and 2 is slightly bigger at 13%, but the large majority of children in centre-based services today are aged 3 to 5, and the free preschool year is clearly a big factor driving that picture, with a percentage around 14%, I think it is, who are after-school children attending childcare services in the afternoons. And a similar story is told by this picture, which is the mix of lengths of time that children spend in centre-based services. More than half of children in centre-based services are in sessional care, particularly in the free preschool year, with only 19% in full-time care. So next I'm going to look very briefly at what the centre-based services are like in terms of their sort of management structures. Well, about 3/4 of centre-based services in Ireland are private. About 1/4 are community run, and certainly we're arguing in this report that if we're talking about the market model, we're meaning both private and community. They all have to operate within this market model, functioning as, in effect, enterprises. It just depends whether you're a private enterprise or a social enterprise. That's all the market model. There's a tiny little sliver in the middle, which I've left for early start providers. So these are the early start units in primary schools, which in a sense is the closest thing we have to what is regarded as public provision of early care and education in many other countries. And I'll come back to early start in a minute. In terms of the size of services, we don't have any published data giving a distribution of services by size, but just to illustrate with from some of the interviews we carried out, we certainly found a huge spread in the size of services and companies, from sole traders at the small end companies, both private and community, up to chains and multiples of services. And it's probably very hard to read, but there are some of the case studies in the report just illustrate this variation in size of services. So at the small end, we spoke to a number of sole traders who are basically just delivering the free preschool year to 22 children. That's a pattern that is now quite well established. In terms of middle-sized companies, I've taken as an example here a community service with 47 children, which isn't far off the national average. And the one I've got here in the case study, that's got 4 full-time staff and 5 part-time staff working there. And then at the larger end, there are chains with multiple sites. So one example I've got here on the slide is a company that runs 4 different services. 594 children attend at some stage in the week, but as lots of them are sessional or part-time, there are only 311 childcare places across those 4 sites. And in terms of the size of an individual service, among those we interviewed, they ranged from 22 children up to 167. So we're talking about a sector, as you well are aware, with a great diversity across it. In terms of sources of funding, taking private services first. So as I said at the beginning, I think the free preschool year has really changed our sector in many ways, and also all private services now rely to a large extent on free preschool year for funding, and quite a number of private services rely entirely on the free preschool year for funding. Of course, parental fees for all the other private services are a core source, and often typically more than half of the income would come from parental fees. And a small amount of income for private services comes from the SET scheme, which offers a small number of places across the country. In terms of community services, the picture's a little more complex. Clearly, community services mostly, there are a few community services that don't provide the free preschool year, but they're very few in number. So most provide the free preschool year now. The community childcare subvention is perhaps the most important source of funding for community services, but crucially, there's a maximum income from the government of that of €95 per week for a child. And that limit means there's always a shortfall in delivering a full-time place in it for a community service. And that shortfall has to be met from somewhere. So parents are asked to pay contributions in community services, but often, in particularly disadvantaged areas, they simply can't afford the full cost of delivery. So community services are also reliant on a range of other sources of funding, such as community welfare officers, who may pay some of the parental contributions. The CE scheme, lots of community services, including some of those we spoke to, are dependent financially on having some of their staff funded through the community employment scheme. And clearly there's also the SET scheme in community services as well. And just to make the contrast, I've included Early Start here, and it's a very different picture. Early Start units in primary school they have the wages of the teachers in them paid by the government, and a capitation grant also paid by the government. They are fully funded by government, and they are much better funded than services that are delivering the free preschool year. So according to a publication from the Department of Education earlier this year, the cost of Early Start to the government is nearly €4,500 per child per year, which is nearly double the capitation grant that services receive for the free preschool year. So Ireland's market model is also seen in the lack of coordination of provision, the lack of control of access and of fees. So looking at affordability, there are no limits set for the cost of services. Professor Penn talked about some countries where fees are capped, such as in Norway, for instance. There's no capping of fees, and we have parents face some of the highest childcare costs in the EU, in Ireland. The exceptions to this, of course, are the free preschool year, which is supposedly free to parents, and the SET scheme, where there is a cap set on fees. The state provides €145, and parents make a contribution, but it's capped at a maximum of €25. In terms of access, there are no entitlements to places. Even the free preschool year, it's not an entitlement. It depends on whether there are services that happen in your local area that happen to take part in the scheme. Now, actually, take-up is very good, but it's still not an entitlement. And the community childcare subvention, there's a big problem, as the coverage is partial. It's very patchy around the country, and even if you're eligible to a place, if you're on a social welfare payment, if there happens not to be a community service near you taking part in the scheme, you can't access the subsidised place. So we have no entitlements to places. As I said, the community service is very patchy coverage. We have no coordination of service provision. That's linked to the issue of entitlements. If a scheme is an entitlement, then the state has to take responsibility for making sure that there is provision in all areas of the country. So there's no requirement on, for example, county childcare committees to ensure availability of places in all areas of the country, which is something you see in some other countries. And childminders, of course, as I mentioned earlier, are effectively invisible and certainly not coordinated in any way. I'm going to talk briefly about the incomes of those working in early years services. Firstly, staff. So again, it's maybe hard to read, but the figures are all in the report. There's no official data published on wages in the sector, but we asked all those we interviewed about the wage structures in their services, and the figures are taken from what our interviewees said. And at the bottom end, we asked all the providers, what's the starting wage for somebody, say, with FETAC level 5 coming into your service for the first time? And the wages are typically in the region €9 to €10.50 per hour. So we're just above the minimum wage, often part-time work, and often precarious, with staff laid off in the summer months. More senior staff clearly earn higher wages. There was quite a spread. The services varied greatly, as I said, in size and structure, so we can't really compare service with service, but there was a spread of wages for more senior staff from 11 up to €17 per hour. With service managers that we spoke to, typically earning in the region of 28 to 38,000 euros as an annual salary. And to give the contrast again with schools, the starting salary for a primary school teacher, starting salary, is 30,700 euros. So the starting salary for a primary school teacher is more or less the same as what you're going to earn as the manager of a large service if you're in early care and education. In terms of profits for owners and owner-managers of services, it proved very hard the figures are hard to compare across services. So we don't have any clear figures. What we clearly got an impression of talking to those we interviewed was a huge spread, huge diversity in how profitable it is, early care and education services are. So at the unprofitable end, we spoke to quite a number of services where the owners or the owner managers were drawing no salary at all. Or one example we spoke to where the owner manager drew a salary of 13,000 euros for their delivering the free preschool year. That was all that was left after all the other costs were covered. So at one end of the spectrum, some services are making, in a sense, no money at all. And at the other end, it's hard to put figures on, and income and expenditure figures are hard to compare across services. But undoubtedly, some services are making money, are making profits, and there are some services that are in the middle, where managers are making salaries comparable to those of service managers, and the services may or may not make some profit in addition to that from year to year. In terms of the outcomes of this market model of provision that we have, certainly quality, what indicators we have on quality suggest that quality of provision is variable. There's very little data on quality. We don't have a quality audit or a quality monitor or anything like that. So we can just use a few sources of evidence that we have. One source of evidence is a study published earlier this year. It was carried out by Jen Naylan, who did observations of 26 randomly selected services around the country using the Eckers E rating scale. And the average quality that she observed, and the figures are in the report, the average quality was poor across those 26 services randomly selected. We have inspection reports, and clearly there are a lot of caveats around using that as evidence of quality. We know that they are primarily looking at health and safety, that they are carried out by public health nurses, but they give us some information about quality. And again, the picture is variable. We know that roughly a quarter of services, according to a report published by Tusler, about a quarter of services are compliant with all regulations, but 6.5% of services are non-compliant with 11 or more regulations out of the 27. So non-compliant with roughly half or more of the regulations, which means at least in that 6.5% of services, there's certainly something problematic. A third thing we can look at in looking at the quality is ratios. Now actually here, I think early care and education, in a sense, is much better served than primary schools. It's the primary school system where the ratios are really problematic. Although the free preschool year, unfortunately, the ratio has deteriorated from 10 to 1 to 11 to 1. And qualification levels, again, it's a mixed story. We do have this minimum qualification level 5 being introduced next September. Qualification levels are rising. However, if we look at the proportion of graduates in the sector, it's still only 13.5%, which is far less than the 60% sort of target set at European level. And I'm going to put up a chart here quickly with some the mix of different qualification levels across private and community services. If we take private services first, those two slices of the pie are the proportion of staff who are unqualified or less than level 5. It's now a very small percentage. Those with level 5 and level 6, well, it's roughly they're roughly equal numbers of level 5 and level 6 in private services, and 16% of those working in private services are level 7 and above. If we take community services, qualification levels are slightly lower. That partly reflects the reliance on community employment for staff. 1 in 6 of those working in community services are on CE schemes. And it also reflects the lower qualification requirements in the community subvention scheme relative to the free preschool year. So 11% of those working community services are unqualified. Now this is, I suppose, last year's data. Things will change by next year when the minimum qualification requirement comes in. More staff at level 5, not quite as many at level 6, and only 10% of those in community services are at level 7 or above. So if the level 7 or above figures, 10 and 16%, if you compare that with the EU recommendation, which is 60% or more of staff should be graduates, you can see that we're falling far behind other countries. However, there is one positive story to tell in terms of professionalisation, and this is figures for the proportion of services receiving the higher capitation grant for the free preschool year, for which you need to have a graduate leading the free preschool year. I'm missing a couple of years' data, but in 2010, when the free preschool year began, 11% of services got the higher capitation grant. The latest figures from the department suggest that 24% of services are now receiving the higher capitation grant. So that's a significant increase. Now, those graduates are typically, they're put in with the free preschool year, seems to be a pattern rather than with younger children. Nevertheless, we are seeing it is in a way the beginning of a professionalization process. And just to close, I'll say a little bit about investment, because clearly all of these limitations in our provision have their roots in the lack of public money going into early care and education. And I'm using here in this chart figures from the OECD. Again, it's reproduced in some fashion in the report. These are figures from the OECD on the percentage of GDP spent on early care and education. There are two, I don't know if you can see, there are two horizontal dotted lines. The lower one is the OECD average, 0.7% of GDP, and the higher one is the 1% benchmark that Professor Penn mentioned earlier, the 1% UNICEF benchmark that's recommended for early childhood services. According to the OECD, Ireland, which is circled in red on the left, the Irish government spends 0.4% of GDP on early care and education. But actually, the picture is much worse than that, because the OECD have factored in the spending on junior and senior infant classes in primary schools. So if we just take out, you see what happens to that column on the left, when we only look at preschool services, it drops right down to less than 0.2% of GDP. That's preschool public investment. It's dwarfed by the level of investment in the Nordic countries, or New Zealand, or the UK, all of which exceed the 1% level. So that's the whistle-stop tour through the facts and figures. And just to recap the key sort of conclusions, yes, we have a market model. It's not a profession. We have a very low level of public investment, and the consequences are variable quality, high fees for parents, unequal access to services, but the free preschool year is, in a sense, perhaps the beginning of a new model, changing the relationship between government and service providers. Thanks very much.